Have you noticed that planks, crunches, or even just standing tall feel harder than they used to? If you're a woman over 40, you're not imagining it. Your core, the muscles that stabilize your spine, support your posture, and keep you moving efficiently, can feel weaker, even if you've been consistent with exercise. The good news is that this is completely normal. The even better news is that once you understand why it's happening, you can rebuild strength safely and effectively. In this video, we'll explore the 8 main reasons your core feels weaker after 40, how lifestyle, posture, and hormones impact it, and practical strategies to regain stability and confidence. Reason 1, hormonal changes affect muscle strength. As estrogen and progesterone shift during midlife, your body experiences changes that impact your core. Muscle mass naturally decreases, fat may redistribute around the midsection, and recovery slows down. This doesn't just affect appearance. It also makes your core muscles feel less responsive and movements more challenging. Reason 2, decreased muscle mass. Sarcopenia. Sarcopenia is the age-related loss of muscle. After 40, women can lose 3 to 5% of muscle per decade if it's not actively maintained. Core muscles, including abs, obliques, and lower back, lose tone, reducing stability. Weak core muscles affect posture, balance, and even digestion. Strength training is the most effective way to counteract this natural decline. Reason 3, poor posture and desk life. Many women spend hours sitting every day. Shoulders hunch forward, the pelvis tilts, and spinal alignment shifts. These postural changes weaken the deep core muscles, like the transverse abdominis, which stabilizes your spine from the inside out. Reason 4, changes in connective tissue, collagen, and elastin in ligaments and tendons naturally decline with age. This means your core muscles lose some elasticity, movements feel less supported, and the risk of strains increases. Mobility work and gentle stretching are essential to maintain core function. Reason 5, previous injuries or surgeries. Past injuries, such as lower back pain, abdominal surgery, or cesarean sections, can affect core activation. Scar tissue may inhibit muscle recruitment, compensation patterns can form, and over time, this can make the core feel unstable. Targeted rehabilitation exercises can retrain these muscles and restore strength. Reason 6, breathing mechanics. Your diaphragm is a key part of your core. Shallow chest breathing, often caused by stress or poor posture, reduces intra-abdominal pressure. This pressure is essential to support the spine, and weak breathing patterns directly affect core strength. Integrating diaphragmatic breathing strengthens your core from the inside out. Reason 7, lifestyle and stress. Chronic stress increases cortisol, which contributes to fat accumulation around the midsection. Fat can physically separate or compress muscles, reducing function. Stress also slows recovery and decreases motivation for strength training. Incorporating stress management techniques like breathing exercises, mindfulness, and gentle movement supports core health. Reason 8, lack of functional movement. Many exercise routines focus on aesthetics rather than function. Crunches and sit-ups alone don't stabilize the spine in daily life. Functional movements such as squats, planks, hip hinges, and rotational exercises train the core as it works in real life. Neglecting functional movement leaves your core weaker over time. Practical strategies to rebuild core strength. To rebuild your core, prioritize functional strength with exercises like planks, side planks, dead bugs, and bird dogs. Resistance bands or light weights can increase engagement. Focus on posture and alignment by doing daily posture check-ins and gentle thoracic extensions and hip mobility exercises. Incorporate diaphragmatic breathing for 5 to 10 minutes a day to activate deep core muscles. Strength training 2 to 3 times per week is highly effective. Compound movements like squats, lunges, push-ups, and rows strengthen multiple layers of the core. Pay attention to hormones and recovery. Sleep, nutrition, and stress management directly affect core function. A protein-rich diet supports muscle maintenance and recovery. Consistency matters more than intensity. Small daily wins, like activating your core properly during movement, matter far more than endless crunches. Final thoughts. Feeling your core weaken after 40 is normal. It's part of aging, lifestyle, and hormonal changes. The good news is that with the right approach, you can restore strength, stability, and confidence. This isn't about chasing a six pack, it's about functional movement, posture, nutrition, and consistent mindful training. At Leap 2, Better Health, we help women over 40 rebuild strength safely with practical strategies that fit real life. Comment below, which core challenge do you notice most after 40? Like this video if it helped you understand your body better. Share it with a friend who wants to strengthen her core, and subscribe for more science-backed wellness tips for midlife women. Remember, your core isn't just about abs. It's about stability, confidence, and moving through life without limits.